Good evening, greetings from Vattikuti Foundation, Detroit, Michigan. At the outset, I thank the organizers and in particular Dr. Arun Prasad to have invited me and given an opportunity to speak to surgeons. It's always a pleasure to talk to surgeons. He wanted me to talk about what was the strategy Foundation used to disseminate robotic surgery and train Indian surgeons in a cutting-edge, expensive technology. Once I'm talking to surgeons about training, I can conclude this talk in one sentence. I'm very clear that no surgeon can be trained by any sophisticated tool or simulators or any kind of surgical thing until surgeon is willing to learn. And that is the story of robotic surgery. Surgeon, until he has a fire in the belly, he believes in technology, he has a grit to learn, we cannot teach him. This is very important, particularly when computers and tools are coming with a jet speed to assist surgeons to do better surgery. Let me tell you that fool with the tool is still a fool. I am reminded of a story very, very long ago when I was a junior resident with an excellent plastic surgeon. Excellent people, those who are very good at crafts, have a potential danger to be arrogant also. And this surgeon was one of those categories. But I always envied and admired him for his skills to take skin grafts, which could be measured with any tool of a uniform size and thickness. So I was very keen to learn from him. After a lot of persuasion, one day he told me, go and buy a pumpkin from the market and get a cutthroat razor, and you will have to sacrifice several pumpkins, but once you are able to skin the pumpkin in one piece with a uniform thickness, I would let you do the graft because I would be confident you would like to do. There would be similar stories in our surgical careers. It's your zeal to learn it. And same thing happened in robotic surgery. To tell you, we trained a lot of surgeons, but all of them did not get on the bandwagon. Only those who believed in technology got onto the bandwagon. To make it a zero-sum game, I would like to show you the first email when the foundation started its activities on August 17, 2010. And this, before I wanted Intuitive Surgical to tell me what is the status of robotic surgery in India. You will see this email that the first robot was started in 2001 by Dr. Trehan at Escorts Hospital, a cardiac surgeon. And the robot in 10 years did 300 cases, of which 260 were cardiac cases and 40 were urology cases. Subsequently, AIMS, almost at the same time, the cardiac surgery department got another robot and that did 200 cases. Care Hospital, a third cardiac surgeon down south, bought a robot which did only 40 cases between 2003 to 2009, and then that robot was shifted to Pune where it did 120 cases. Fourth robot was at the Raja Muttaiah Institute in Chennai, which did 90 cases. And topped the list, the AIMS Urology did exceedingly well, and they did 420 cases. When we took over, Medanta had procured a robot, but they were yet to open an account. So, The account before the foundation came into action in India, we decided to relaunch robotic program from 2001 to 2010. There were 6 robots. All robots combined did 1170 procedures at the rate of 117 procedures per year, and 50% of them were in cardiac surgery. This account is important to tell you that if you don't use the technology at the right place with the right potential, this is going to happen. Cardiac surgery is non-taker for intuitive robot, and that's why we never encouraged cardiac surgery. We did make efforts to do that. Now, Vattikuti Foundation, in contrast, I'm giving an account from 2011 to 2018, where 72 installations were done. Robotic surgeons, we trained 379 robotic surgeons, and I already alluded, a lot of them are stalled surgeons. We brought a spectrum of 8 specialties where the robotic surgery is being done with very high amount of surgical skills, and around 25,000 surgical procedures have been done, of which 62% are in urology, but other specialties are picking up. We very soon realized in the game that since we are training already very accomplished surgeons, the only thing which will help is to train them in their own environments, on their own patients, adequately building a safety net with the proctors, and foundation invested huge amount of its budget in bringing close to 150 proctors in all the specialty. There's another thing which we worked for the surgeons is, I was very frequently in touch with most of the surgeons, and we tried to meet with their unmet needs. Whenever we found a procedure, they have large amount of volume but no skills to do, we always brought a proctor who could give a push. To give an example, it was hernia surgery, or it was, for that matter, continent diversion after cystectomy. We brought the experts to give a push to these surgeries. Our initial strategy was that we wanted to look for champions, and we look for champions, not only champion surgeons but champion institutions, who we invested in making these champion surgeons as institutions. I would not say that our selection was 100% right. We learned with our mistakes, but most of them, I am very happy to say, are in this crowd doing excellent robotic surgery. Once we identified champion surgeons and champion institutions, we played the strategy of competition and cooperation. We are all in competition with each other. Hospitals are in competition, surgeons are in competition, and I don't think competition is a dirty word to do. But how it helped robotic surgery is that very soon it became a demand-driven market, as it is in the United States. Hospitals started and surgeons started losing patients because they would like to have this new modality to be used for their infirmities. So many hospitals were peeved with us because no good surgeons would join them until they provide a robot. And that's how it became an ortho-run. There was a story of cooperation also, and many institutions, the urologists help other specialties to develop robotic surgery, because the domain knowledge was with the specialty surgeon, but the urologists help them how to use robot to do a particular operation. I was very curiously looking at the studies on how these human traits work, competition and cooperation. And I was amazed to see that we inherited The original thing was a cooperation, and it is an animal instinct we inherited it. And you would know that animal herds would stay together in order to protect themselves or the herd from the predators. But sooner it became a competition, and it became a dirty competition. But the neuropsychological basis for cooperation and competition, as I show in this slide, that it is in the frontoparietal area. In fMRI studies, both these areas are the insular areas, and they are superimposed on each other. So both of these traits exist together. Out of the foundation plan that we would need 400 surgeons, on an average 4 surgeons, 1 installation in different specialties. So foundation wanted to train, because by then there was a lot of interest in younger surgeons and surgical trainees who made up their mind that they would take up their career as robotic surgery. So we started a very successful fellowship program, and many of you, I must thank you from this platform, who really mentored surgeons to the level that they could go and independently run robotic programs. Here are some examples wherein I'm very happy to say that it's not only 1 year which was important for surgeons to be trained, but it was a longitudinal contract, and the mentors went to give them a confidence and push to start independent robotic surgery program. Foundation invested in robotic fellowship programs, not only in training the surgeons, but making them academic giants. And we did, our fellows presented, practically each fellow had an opportunity at the cost of the foundation and go and present their work on international meetings. To sum up, it was a wonderful experience. Foundation acted as a catalyst at the most. Ingredients were here. We exploited large volumes. We exploited the passion of the surgeons, few champions who believed in technology, and rest of them got onto the bandwagon. Once again, thank you for your patient hearing, and I'll be very happy to take questions if you have any.